Chronic pain can feel like a relentless shadow, but what if there were natural ways to chase it away? Dr. Kunal Sood, a renowned anesthesiologist and pain management specialist, has unveiled 7 natural strategies that could help ease the burden of chronic discomfort without relying solely on prescription medications. But here's where it gets interesting. Not all remedies are created equal, and some might surprise you. Let's dive into the science-backed options and the debates they spark. Living with persistent pain is exhausting, and while pharmaceuticals are often a lifeline, many seek complementary solutions to reduce inflammation, soothe aching muscles, and boost their quality of life. Dr. Sood, in a recent Instagram post, shared 7 natural supplements he recommends, but with a crucial caveat. Always consult your doctor first. Dose varies with individual health histories, and starting small can help identify side effects. Still, for many, the benefits might just outweigh the risks. 1. Turmeric, the golden anti-inflammatory. Turmeric's star component, curcumin, isn't just a kitchen staple. It's a powerhouse of anti-inflammatory and antioxidant properties. Dr. Sood explains that this compound can help calm the body's overactive immune response, which often fuels chronic pain. But here's the catch. Curcumin is poorly absorbed on its own. Pairing it with black pepper or choosing a bioavailable supplement might be the key to unlocking its full potential. 2. Vitamin D, the sunshine hormone. Vitamin D receptors are scattered throughout the body, including the nervous system. Some studies suggest that this vitamin might regulate pain signals and nerve function. Dr. Sood notes that low D levels are linked to heightened pain sensitivity, making supplementation a no-brainer for those deficient. But what if your levels are already normal? Is more always better? The debate continues, and experts urge caution to avoid toxicity. 3. Ashwagandha, stress's nemesis. Stress and anxiety don't just feel bad, they can amplify chronic pain. Enter ashwagandha, an adaptogen that helps the body manage stress and improve sleep. Dr. Sood highlights its role in recovery, but skeptics argue that its effects are subtle. Would you try a herbal remedy over a sedative? The choice might depend on your tolerance for natural versus pharmaceutical solutions. 4. Fish oil, omega-3s for joint health. Packed with omega-3 fatty acids, fish oil is a natural anti-inflammatory. Research shows it can ease arthritis-related pain, but the jury is out on whether it works for all types of chronic pain. Plus, the environmental impact of overfishing for supplements raises ethical questions. Is the planet worth the pill? A thought worth pondering. 5. Magnesium, the muscle relaxer. Magnesium isn't just for leg cramps, it's a multitasker. It eases muscle tension, improves sleep quality, and even tackles constipation. But here's the part most people miss. Magnesium deficiency is often overlooked. Could a simple blood test reveal the root of your discomfort? The answer might surprise you. CBD, the controversial cannabinoid. Derived from cannabis, CBD has shown promise in managing neuropathic pain and osteoarthritis. Dr. Sood acknowledges the research, but stresses the need for more studies. The legal gray area surrounding CBD adds to the confusion. Should governments regulate it more strictly, or is the market ready for self-regulation? Share your thoughts in the comments. Glucosamine, chondroitin, the joint protectors. These compounds found in cartilage are staples for arthritis patients. The National Center for Complementary and Integrative Health backs their use for osteoarthritis, but results vary. Some swear by them, others report no change. Could this be a placebo effect in disguise? The scientific community is still debating. Final word, while these natural remedies offer hope, they're not magic bullets. Chronic pain is complex, and what works for one person might not for another. Dr. Sood's advice? Combine these strategies with medical guidance and lifestyle changes. And remember, your health journey is personal. What would you prioritize? Herbs, supplements, or traditional meds? Let's discuss in the comments.